Hi, I'm Ed Berry. Welcome to a special edition of your Workers' Comp Minute. I'd like to talk with you briefly today about peer reviews. Peer reviews are nasty little things. In order to understand them, you must first understand a general fundamental tenet of Alabama workers' compensation law. That is, the company gets to choose the doctor, i.e. the company doctor, and the worker gets the reasonable treatment recommended by the company doctor. This general tenet is under a covert guerrilla attack at this moment. You see, there are administrative regulations promulgated by the Alabama Department of Industrial Relations, which basically state that if the company or its insurer does not agree with the treatment recommendations of its company doctor, it can overrule them. It does this through the peer review. Basically, it has an outside doctor or an internal staff physician to disagree with the treatment plan of the company doctor. Once this disagreement is documented, then the insurer or the company no longer has to follow the treatment recommendation of the company doctor. Now, you would expect that this peer review process would be used sparingly. After all, the company would normally send the injured worker to a competent doctor in the first place. However, even during the short treatment span of one injured worker or patient, I would often see neurosurgeons or orthopedic surgeons overruled multiple times by out-of-state doctors who have never seen the patient. This is a major problem, and the peer review process is being sorely abused. Now, it normally happens very simply. An orthopedic surgeon or a neurosurgeon will do diagnostic testing and determine that a worker needs a surgery because of an on-the-job injury. The doctor will notify the company and the insurer, and the doctor will schedule the surgery. On the morning of the surgery, the doctor's office will receive a call, and the call goes something like this.
Hello, is this Dr. Berry's office?
Yes, it is.
This is Melissa from Acme Insurance Company. We've received Dr. Berry's request for approval for a back surgery for John Doe. We sent Mr. Doe's medical records to our peer review doctor. Doctor, I'll say whatever you want me to say, in Nowhere, New Mexico, and he has advised that the surgery is not necessary. I'm sorry, we won't be able to approve it. Okay? You have a nice day.
As you have just heard, the company doctor has been effectively neutralized with a peer review bomb. The worker probably won't receive any further medical treatment until a lawsuit is filed, an evidentiary hearing is conducted, and a judge orders the company to follow the recommendations of the company doctor. There's good news and bad news about this. The good news is the testimony of the local company doctor is much more credible and persuasive than an out-of-state doctor who has never seen the patient. The bad news is once you win, it starts all over again.
This is Melissa again, calling from Acme Insurance Company. We have received Dr. Berry's request for post-surgery physical therapy for John Doe. Yes, our peer review doctor has advised us that the physical therapy is not necessary. I'm sorry, we won't be able to approve it. Okay? You have a nice day.
I'm Ed Berry with your Workers' Comp Minute. To refer a case, call me at 324-6021.